Thank you. I am here today to sound the alarm for public health and to sound it as loud as I possibly can. Because this week, RFK Jr. took a dangerous, practically unthinkable step to undermine public health and vaccine confidence. He fired every single member of CDC's vaccine advisory panel, every single one. And he's already packing the panel with people who advocated letting COVID rip through our communities, who serve as board members of vaccine disinformation groups, who promoted conspiracies and quack treatments for COVID and measles. And he's just getting started. It is really just about impossible to underscore how reckless and unprecedented this is. I mean, even some Republicans who voted for him only did so after he convinced them he would not go this far. Of course, they should have known better. I warned them, you can't trust this guy. He has a long history of attacking science and vaccines at every turn. He is not going to give up that crusade when you give him tremendous power to wage it. But they ignored the obvious warnings, and now here we are. Let's be clear, RFK Jr. is not just crossing a red line for public health, he is sprinting into dangerous, uncharted territory in support of totally deranged conspiracies, and he is dragging us all along with him. He is putting our communities and our families in harm's way. Here's what everyone needs to know. The CDC's Vaccine Advisory Panel has a simple, important job. Look at the data, look at the science, and make recommendations on the vaccines FDA has approved as safe and effective. That work has serious repercussions. These recommendations impact public confidence and trust in our vaccines. These recommendations are trusted by healthcare providers as they talk to their patients and discuss their personal health decisions. And these recommendations affect whether health plans, including Medicare and Medicaid, are required to cover vaccines at zero cost to patients, or insurance companies can force Americans to foot the bill for vaccines that keep them safe, or parents get guidance about which vaccines their children should receive and when. Guess what happens when vaccines become more expensive for patients? Guess what happens when Trump's highest-ranking health official ignores the facts and tells people our vaccine experts cannot be trusted? Guess what happens when RFK Jr. packs the CDC Advisory Committee wall to wall with his favorite anti-science grifters and conspiracy pushers? Fewer people will not get vaccinated. This is not rock science. Maybe they think because of RFK Jr.'s disinformation that measles isn't a big deal. Maybe they think incorrectly that it's safer to get whooping cough than the vaccine. Maybe they just can't afford it anymore because the vaccine they wanted to protect their family is no longer covered by insurance. Whatever the reason, the result is going to be the same. Diseases that we can fight, diseases that we can prevent, spreading like wildfire through our communities, our schools, our nursing homes. Kids are going to be hospitalized and even killed, all because one conspiracy theorist thinks he knows better than qualified medical experts and centuries of research. We've already seen an historic measles outbreak on RFK Jr.'s watch. His response to it? It's been a complete disaster. He's promoting quack cures, spreading lies about vaccines, and cases are skyrocketing. And if RFK Jr.'s flood of disinformation is allowed to drown out real science, it's not just going to be measles. We're going to see a full parade of horrors come raging back. We have to speak up, and we have to make sure we are countering nonsense with reality, with facts. We have to make sure parents get the message. Vaccines are safe, effective, and life-saving. So I'm using my megaphone today to not just raise the alarm, but to raise up the voice of an expert who knows the science of vaccines and who knows the stakes of this moment. I'm very pleased today to be joined by one of the CDC advisory members RFK Jr. is trying to silence through firing, UW's own Dr. Helen Chu.
Thank you so much, Senator Murray, for inviting me to speak today. I am an infectious disease doctor, professor of medicine at the University of Washington, and I teach the vaccines course at the university. And my career has focused on how vaccines protect children from infection. And until Monday, I was a member of the CDC Advisory Committee on Immunization Practices, which, as Senator Murray has just pointed out, makes the recommendations for vaccines for use in the United States. So you may not know what the ACIP is or what it does. So I wanted to take this time to explain why our work is so important and what is at stake now. The means by which vaccines are recommended for use in the US is a careful, deliberate process that has been in place for over 60 years. Because vaccines are given to healthy people, they are held to an extremely high standard of safety. This is different, for example, from chemotherapy, which is given to people who are already sick. This process involves a group of experts who are assembled to review the safety data, the effectiveness data, decide which groups need the vaccine, and whether or not they are cost effective. All of this happens continuously, both before and after the vaccines are rolled out for use. When ACIP recommends a vaccine, that means it's paid for by health insurance. And for children without health insurance, this is paid for by the federal government. I'd like to illustrate this process with a recent example. Respiratory syncytial virus, or RSV, causes severe illness and death in young babies and older adults. RSV vaccines were just developed and recently made available for use in older adults. However, when we reviewed the data, we saw a safety signal for something called Guillain-Barré syndrome, which is a very rare neurologic event. And we saw more cases in people who received the vaccine. We had several hours of discussion about the risks and benefits of this vaccine. And ultimately, what we decided was to recommend this vaccine only for use in high-risk adults who are at higher risk for severe RSV disease, and not recommend it for use in healthy older adults, because the risk of Guillain-Barré could outweigh the benefit of protection against RSV in this group. And I think this example really illustrates the approach that the ACIP takes, that what we do is rooted in science, and that the decisions we make do not necessarily benefit the companies that have invested heavily to develop these vaccines. As a result, ACIP is widely regarded as an international gold standard for vaccine decision-making, and other countries have in the past considered the US as a model to guide their own vaccine policies because they could be sure that the decisions we reached were unbiased and based on evidence. But that may no longer be the case. If we have a system that has been dismantled, one that allowed for open, evidence-based decision-making, and that supported transparent and clear dialogue about vaccines, and then we replace it with a process that's driven largely by one person's beliefs, that creates a system that cannot be trusted. And in the absence of an independent, unbiased ACIP, we can't trust that safe and effective vaccines will be available for use in the United States. And instead, it will be replaced by a patchwork of different policies by different states, and each state will have to make its own decisions. And I really worry about the health and safety of people in our country and the future of our public health infrastructure. So thank you.
All right, now we'll have time for questions. So if folks can use the raise your hand function.
This question's for Dr. Chu, Jay Goldstein Street from the Washington State Standard. Can you talk a little bit about the vetting process you went through to be appointed to the committee and any sense you have of kind of what it would mean that Secretary Kennedy's already named replacements and what vetting process they would have gone through in comparison?
So I don't know anything about the vetting process the new appointees went through. I can tell you that for me, the process has took 2 years, that we are initially asked to apply to be on the committee. Then we submit letters of recommendation. Then all of our credentials are reviewed. And then we go through an extensive process of reviewing our conflicts of interest and making sure that we are unbiased when we serve on this committee. That took 2 years for me to be appointed as a voting member.
Hey, Dr. Chu, thank you so much for doing this. This is Elise from the Seattle Times. Wondering what you think about the new ACIP members who have been announced so far.
I don't know enough about them to really comment on what their decision-making will be. I can tell you that the members in the past have been people who have worked extensively in the vaccine space, who have been devoting their lives to vaccine policy. And so I hope that the new members will do the same. We'll take this very seriously, and we'll make sure that the decisions they make are for the good of the American public.
Yeah, hi. Thanks for taking my question. My question goes to Senator Murray. Is there any action you're thinking of taking in the Senate in response to what Secretary Kennedy has done?
Well, despite my warning everybody that Secretary Kennedy, before he was confirmed, was going to be hell-bent on going to where we now see he is, on jeopardizing Americans' ability to know that their vaccines are safe and secure, what their dosages are, to make sure that they're covered by insurance because of the ACIP regulations that have been there that we have counted on. I predicted this would happen, and it did. So my Republican colleagues who voted for him need to speak up now loudly, and they need to tell Secretary Kennedy that this is not acceptable. We need to put in place the members that were there that were vetted, as you just heard, not people that he has picked overnight, that we're just getting some of the names now, and they have some very serious background that I'm worried about.
I have another question, if that's okay, for Dr. Chu. What advice do you have for practicing physicians in terms of what comes out of the committee and, what they should be looking to for recommendations to patients?
Yeah. This puts us in a very dangerous place. If we can't trust the national recommendations made by ACIP, we do have to start turning to other sources. So what I've been telling people is that they can go to the American Academy of Pediatrics, the American College of Obstetrics and Gynecology for pregnant persons, the American Academy of Family Physicians, that these groups are still working to review the evidence and to put out science-based recommendations. My fear is that we are going to turn into a country where each state is going to have to make its own decisions. Unfortunately, Washington State is a place where we have experts and scientists who work together. There are other states where this may not exist or where they may not choose to recommend vaccines. So that is going to create a lot of chaos.
And I would add one thing. What is extremely worrisome is that ACIP is used for people who provide insurance to know which vaccines to cover and are required to cover. And if they are not covered by your insurance, no matter where you live, it's going to be really hard for parents and people to be able to afford these.
Thanks very much for doing this. I'm wondering if either of you were surprised by the recent emergency resolution passed by the AMA, urging Secretary Kennedy to restore the original 17 members to the committee. And is there anything that the AMA could do to influence things?
I would just say thank you to them for doing that, and I hope that our colleagues in the Senate here will take that and go to Secretary Kennedy and to the President and the administration and enforce that and use that as why why our members need to be reinstated.
And were either of you surprised by this resolution? Since I think AMA has been relatively quiet on criticizing HHS.
I am happily surprised. I think that they made the right step, and it tells you how serious this is.
Thank you.
All right, and our next question is from Leah.
My question is for Dr. Chu. I wanted to ask about the size of the new committee. I think it was a pretty big cut from 17 members to 8 members. Wondering if you have any comments on how, the size of the committee might, having a much smaller committee might affect how it operates.
I don't know that this size of, I think 8 is the final size. There is a ACIP meeting in 2 weeks, and we need quorum to be able to vote at that meeting. And so I'm not sure what the plan is for the next several days. Is there a plan to appoint several other members to this committee? I imagine so. But I don't know. I don't have any details about that.
Hey, this is Jen Bendery. I'm with the Huffington Post. Senator Murray, I just wanted to ask you, it sounds like you do know a little bit about the ACIP members that Secretary Kennedy has picked. And you said something a few minutes ago about how you have deep concerns about their backgrounds or something. Can you share a little bit about what you do know about who he has picked? Because I haven't seen much out there yet.
Yeah, I mean, we're just getting the names and we're just vetting and taking a look at them. I do know one, Dr. Robert Malone, who has downplayed deaths that are related to one of the largest measles outbreaks in the U.S. in years. He claimed that Americans were, I think, hypnotized into taking COVID-19. We are obviously going to get more information, but clearly this is somebody who gives me deep concerns about him having a say over what vaccines we should be taking.
All right. Any final questions or follow-ups? Hearing none, I'll turn it back to Senator Murray to close us out.
Dr. Chu, thank you. Thank you for your years of service. Thank you for what you do. We will stay loud, and I appreciate everything you're doing, and I want everyone to know that I know there's a lot going on in the world. There seems like a lot of chaos. We need to make sure that this administration is responsible, science-based, and that is not the case right now under Secretary Kennedy. Use your voice, speak up.
Thank you. That will conclude today's call. Again, this will be recorded and distributed widely.